Hi, this is Tamika Chambers. Another day, another question. As always, try to have a sheet of paper out and something to write with. And as you read the question and your selections, definitely write down what your answer is, as well as your rationale, to see how in alignment your rationale is with the question's rationale. All right, your client has been getting total parental nutrition, TPN, for bowel rest for the last 4 days. During your assessment of the client today, your client tells you that their chest hurts. You assess that the client is also experiencing dyspnea. What is most likely occurring with this client, right? So we're looking at the relationship between symptoms and, if you will, a diagnosis, right? We're not the ones to diagnose, but as nurses, we need to have an idea of what's going on, right? Because that will drive what we do. So our keywords are TPN, 4 days, chest hurts, dyspnea, likely occurring. Is it your client may be experiencing a fluid overload, your client may be experiencing an embolus, your client may be hyperglycemic, or your client may have an inadvertent pneumothorax. So we have to grab the pieces to the puzzle. We have to grab that. Which one of these statements actually makes sense given these keywords that we have? So go ahead and pause, make your selection, write your rationale. So I apologize, A, B, C, D are not here. So you can kind of use 1, 2, 3, or 4, whichever way you like it. But when we look at chest hurts, TPN, and dyspnea, are they experiencing fluid overload? What are those symptoms that are associated with fluid overload? Do we have anything about jugular vein distension? Do we have anything about the crackling? Are we hearing that? Your client may be experiencing an emboli. Could be embolus because they're having the chest pain, their dyspnea, and they had a TPN, a tube place, right, for the last 4 days. So your client may be hyperglycemic. Is there anything in here that says the client is hyperglycemic? Do you have any high blood sugar symptoms? Very important for you to know regarding as you take your NCLEX exam. And an inadvertent pneumothorax, when is that likely to occur? Well, the last statement, that's likely to occur, as they're actually putting in the line. So this is something they've had for 4 days. That's why it's important to look at that keyword 4 days. Fluid overload, we have nothing else to tell us that they could be experiencing fluid overload, edema, swelling, or anything like that. Hyperglycemic, there are no symptoms of PPPs, right? Polydipsia, polyphagia, polyuria. So our answer is going to be, you guessed it. All right, you guys, I will talk to you soon. Remember, write your rationale and why you picked that answer so that you can see, is your thinking in alignment with the question's rationale, or are you thinking like a nurse? All right, focus on that. Think like a nurse. You've been trained as a nurse. It's time to apply that knowledge that you have, that valuable knowledge. I'll talk to you guys soon. Take care of yourself.